So this morning we have 4 experts in their fields. Very privileged to have them here to talk about the aging issue. I'm going to quickly introduce each one of them and then come back to Mr. Colgan to start the conversation. So we have Charlie Colgan, who's many of you know is a professor of public policy management at the Muskie School of Public Service. He is a chair of the Master's Community Planning and Development Program. He is also Associate Director of the University of Southern Maine Center of Business and Economic Research and a Senior Fellow at the Center for the Blue Economy in Monterey, California. Next, we have Dr. Lisa Letourneau with us. She is the Executive Director of the Maine Quality Counts, a regional health improvement collaborative. She also serves as a physician champion for several quality improvement efforts, including the Maine Aligning Forces for Quality Initiative and the Maine Patient-Centered Medical Home Pilot. Dr. Letourneau is a board-certified internist who practiced emergency medicine for 7 years before beginning her work in clinical quality improvement. Next, we have Evan Richert. I could tell you about Evan Carroll as well, but we won't. Evan Richert is the land use planning consultant who serves as Orono's town planner. He provides staffing assistance to the town planning board, town manager, and town council. He is a member of the American Institute of Certified Planners, and we welcome you, Evan. Thank you for being here. And last but not least, at the end of the table, we have Mr. Peter Vigue. He is the chairman, president, and CEO of the Cianbro companies. Mr. Vigue has over 40 years of experience in the construction industry and has transformed Cianbro into pioneers in the construction industry. As chairman, Mr. Vigue is an innovative and results-driven leader focused on achieving exceptional results in highly competitive environments that demand continuous improvements while building partnerships with key business decision makers. Also an advocate for workplace safety, Mr. Vigue incorporated worker safety into the company, expanding the effort to include the personal health and wellness of all team members, and this is one of the reasons why Cianbro was named one of AARP's best employers in 2013. So with that, welcome all of you. We are going to have a conversation, and I think it would be important to start with you, Charlie. You were with us, helped us frame the conversation at the Speakers Roundtable, and if you will help walk us through a bit of the economic impact on the state of Maine related to our aging demographic. And I will preface this as Charlie gets up here. If there's any, I'm trying to be careful here. If there's any, I don't want to say downer, but I'm going to say it because some of the demographics can be paralyzing. But what we want to do is move through that and continue to focus on our opportunities. So I would say, as you hear some of the numbers that Mr. Colgan's going to be talking about, don't stop there. Keep listening and thinking about the opportunities that we have. So with that, have at it.
Thank you, Representative Eves. 2014 marks the 60th year that I have been in Maine. I was born in New York, came to Maine in the summer in 1954 for the first time. Been here continually since 1976, working in state government or the University of Southern Maine. Over that period of time, Maine has hugely changed. It has gone from a state which was the leading shoemaker in the world to a state that makes practically no shoes. We've gone from a state in which the healthcare industry provided less than 1 in 10 jobs to a state in which healthcare provides 1 in 6 jobs today. And the number of manufacturing jobs is less than half of what it was 40 or 50 years ago. In other words, Maine and Maine's economy have been no strangers to dramatic change. We have gone from a state that was primarily dependent on natural resources and low-wage manufacturing to a state that resembles, in its general structure, the rest of the national economy. We are much more like Maine. Maine today is much more like the U.S. than it has been really since the founding of the state. So I start there because the changes that are coming are really the next iteration in a story of evolution in Maine. We shouldn't see them as necessarily though there are very different parts of the story, we shouldn't necessarily see them as an abrupt change or merely but part of a long-term evolutionary process. Okay. Yeah, that's what I was using. Okay. So here are the numbers. There are two groups that you have to pay attention to understand the implications of our demographic shift for Maine. One is obviously the group of over 65 people, but equally important, you must understand the evolution of the younger population. You know, we are the oldest state in the nation, but I want to point out that we're only 1/10 of a year older than New Hampshire and 2/10 older than Vermont, so let's not let them get away with this. The major reason we are older by median age is partly because we have an older population, a higher proportion over 65, but mostly because we have a much smaller population under 35. And it is the young people as well as the old people that are shaping the Maine economy. And you must see the two together. And that's what I've shown here. The blue line represents the people between 20 and 34. This is out 50 years in my current long-term forecast. You can see each of the decades. And there are several stories in this graph. The red line represents the baby boom generation, essentially. The leading edge of the baby boom generation, those born in 1946, turned 65 in 2011. The leading edge of the baby boom will turn 80 in 2026. The trailing edge of the baby boom, those born in 1964, will turn 65 in 2030. And the trailing edge will turn 80 in 2044. So we are looking at the baby boom generation essentially shaping the Maine elderly population for the next 40 years. That's how long this aging demographic will shape Maine. At the same time, if you look at the younger population, I've shown here the population of 20 to 34-year-olds who were born in the 1980s, and you'll see that they have substantially declined. In fact, from 2000, from 1990 to 2010, that population declined by 20%. And you can see that same population growing again a little bit, but then their children, because there are so many fewer of them, we hit another big demographic shift in the 2020s and 2030s. We really have two phases to this aging population in the future. The one is started now and will last through the end of the next decade. This is the younger population. This is when population is younger, and it will be, the older population will be in their younger aging years. And we will face a significant shortage of workers in the population as a whole. This will be our major problem, is we will go from a worker abundant population in which wages and salaries have been traditionally below the national average to a worker short population and economy in which we will have to pay more for labor. And this shift is one of the most profound shifts in the economy. We will have to not only pay more for labor, but we will have to get labor from untraditional sources, not just the schools. We will have to get them from the rest of the U.S., the rest of the world, the aging population itself, and populations underused today, like the disabled. There are 4 challenges that we face. One is we're going to have to get people to move to Maine, particularly young people. The green line here is natural population increase. Well, natural population decrease. All of Maine is now, deaths are now exceeding births in all but Cumberland County, and Cumberland County will catch up very shortly. So all of Maine's population growth for the next 40 years will have to come from in-migrants, from somewhere else. In this model, in the 2030s, 2010s, we'll have to bring in 5,000 people a year. In the 2020s and 2030s, we'll have to bring in 7,000 people per year. Last year, we brought in nobody. Our population actually declined slightly last year. So that's the population, that is the most significant edge of the demographic. If we don't replace the baby boom, job growth diminishes. The blue line represents 50% of needed migration. The red line, a significant, almost 90% decline in population, in migration, and the result is the labor costing much more. Our second challenge is putting old on hold, managing the post-retirement workforce. Overwhelmingly, the baby boom generation will work much longer than its parents. From an average retirement age of 57 in 1991, average retirement today, as reported in the Gallup poll, is at age 61, so we are retiring much later, and people are expecting to work much longer. The number of people over 65 who expect to be in the workforce has significantly grown over the last 20 years. In a study that we did in Aroostook County in 2007, over 80% of the respondents and over 85% of men, 75% of women, expected to continue to work after they retired from their principal job. How will we accommodate those expectations in organizations that have been essentially devoted to the intake and training of younger people? The third challenge, changing the landscape. The baby boom shaped the Maine landscape. We came here, we built houses, we built 2-car garages and put a basketball hoop up. We did it further and further from the cities, and now we're going to figure out whether, now that we've got empty nests, are we going to move closer to the cities, back to the cities? Are we going to stay where we are? Are we going to pack up and leave for Arizona? Yes, we'll do all those things, but how much of each? The 2010 census showed that in each of our urban areas, the core cities, for the first time in decades, have grown in population. Much of that growth, whether in Bangor, Portland, or Lewiston, Auburn, has occurred in the core cities, with Portland getting the largest share of the growth. Most of the growth is still happening out in the suburbs, but for the first time, it looks like there is a big shift inward. And one of the big issues that we will face is multifamily housing. Right now, Maine is one of the lowest producers of multifamily housing in the country. Frankly, multifamily housing, except for the elderly, is illegal in most towns. How are we going to accommodate the younger workforce that needs to come to Maine and the older people who are looking to retire into smaller housing units? Will we separate those on the landscape and have older communities and older housing projects, which is what we've done so far, or will we integrate across integrated age communities, as a lot of experts have suggested is the right way to do this? Finally, finding economic opportunity in an aging population. When we look at the question of economic opportunity, what we look at is what are called clusters. Clusters are combinations of technological innovation, organizational innovation, new markets, and the ability to be more competitive by essentially competing with and cooperating with organizations within our region. Main traditional clusters include things like agriculture, forest products. We have emerging clusters in things like composites and geospatial technologies. What are the clusters of economic activity, of economic opportunity that will rise from the evolution of Maine's demography? I've suggested that Google self-drive cars represent a significant possibility here, but what I'm really saying is that technology and the way in which we use technology are going to drive much of what this opportunity is going to be, but so will innovation in our organizations. Maine is one of the most heavily dependent states on nonprofits to deliver health and social services, much more so than many other places. We've already innovated in our organizations. How will we continue to do so? I'm not sure what happened to that one. So here's the road ahead. It is clear, sunny, and completely wrong. This, in fact, is the road ahead. Our job is to navigate it. I completely agree with the speaker that this is managing change. Maine's used to doing change. We know how to manage it. We need to learn how to take advantage of it in the future. Thanks.
Well, thank you, Charlie. And I think that was a great synopsis of what we heard during the speakers roundtable and really got to the crux of a lot of the feedback that we heard in terms of workforce and the impact on our economy. We're going to circle back around to that part of the conversation, but right now, Dr. Letourneau, I want to ask you a question and first frame it by saying that our aging demographic impacts healthcare in two different ways. The Department of Labor says that boomer age workers will be leaving the healthcare and direct care workforce at a time when more workers in this area are needed. And at the same time, older adults need more care. So Maine's healthcare transformation efforts aim to help people stay healthy and in their homes. So my question to you, to start framing this and spark the conversation, is how important is it to Maine's healthcare transformation efforts that we make sure we're able to provide coordinated care for people at the community level?
Great. And we're okay to stay here?
Absolutely.
Thank you. Well, thank you, and thank you, Speaker Eves and Jess, for inviting me today. Although I am still wondering two things. One, what am I doing on an expert panel about older adults and the aging issue? And secondly, where is my easy chair? That's easy chair panel. So I will acknowledge up front that I am not an expert in the issues of aging and caring for older adults. I am not a geriatrician. I see Roger Renfrew out there and thinking, why isn't he up here? And as my mother likes to say, why do they think you know anything about that? That would be my 80-year-old mother who lives in Winslow right down the road. So if you see her, tell her she's right. As Speaker Eves noted, I helped to head up another one of these nonprofits in Maine, Maine Quality Counts, which is a regional multi-stakeholder alliance that brings people together. And my mother would also say, yeah, but what is that? It brings together people, patients, providers, doctors, nurses, payers, employers, policymakers, basically everybody involved in healthcare, because we strongly believe that healthcare in this country is a mess. We all created it, and we all need to find our way out of it. So in answer to your question, Speaker Eves, do we need stronger community-based supports to handle this two-headed challenge, opportunity of an aging workforce and an aging patient population? I would say absolutely yes. We've heard some great statistics on various issues around aging of our population in Maine. We haven't really talked about healthcare yet. And given the limited time, we won't have a lot of time to talk about that, but I think we have to recognize that this tsunami of our aging population happens on top of what I would suggest is a very broken healthcare system in this country and in this state. I'm not sure how much all of you are tuned into that, but the percent that we spend on our economy on healthcare is staggering. Currently 18% and growing every year, targeted to hit over 20%. One out of 5 of our dollars in spending on healthcare is enormous. It's also completely out of whack with other countries around the globe. We spend far more, twice as much as many other countries, and we do not have the results to show for it. You still hear from time to time, yeah, but we have the best healthcare system in the world. We do not. Sadly, we do not. On any measure of healthcare quality, we do not. So we have got to grapple with that. We've got to recognize that with these additional challenges of the aging population. And I would suggest that certainly community-based supports is one essential element of that. I think there are other ways that we need to address this as well. It was referenced that we are in Maine on the forefront of many innovations, and I'm proud to say that in the arena of what I call often healthcare reform on the ground, the work that many, many people in this state are doing, and we are proud to help support through efforts like the Patient-Centered Medical Home Pilot, which is another horrible name, but basically means trying to help primary care do a better job of delivering patient-centered, value-based care, doing a better job at delivering the care that you all want to receive, right? So that when you go in, you can get in when you need to get in, you can be seen by somebody who knows you and has your records and isn't flipping through charts, right? Who can coordinate care when you go see a specialist or, God forbid, you need to go in the hospital, who maybe gives you a call when you are in the hospital, or your mother or your aunt or your uncle, and checks in with them and sees them within a few days of being in the hospital so that they know what their medications are. And I'm describing things that sound common sense, right, but just do not happen right now. So we need to really look at how we are organizing our healthcare system, and through our efforts here in Maine, we are doing a lot of that work. There are many people involved. Maine has been recognized as a leader in the country in some of these efforts around things like redesigning primary care, redesigning payment systems. Our payment system is very, very broken. We just pay for tests and procedures and complications and not necessarily the outcomes that we want or value in healthcare. We are on the forefront of a lot of efforts to try to engage people more actively in their healthcare. So I think we're fortunate for that, and we need to do more of it. So in terms of some of my high-level recommendations, I will repeat what we often say in our work at Quality Counts, which is we need to start with building and paying differently for a more robust primary care system. We all need to have a primary care provider, a doctor, a nurse practitioner, physician assistant, and the team that they work with. We need to understand that that team has to include a lot of non-physicians. There is no way we will be able to keep up with a new supply, a bigger supply of primary care physicians in this state or nationally. It simply is not there. When you pay 2 and 3 times more for dermatologists, radiologists, orthopedists, and anesthesiologists, guess what you get? You get more of those specialties. With all due respect, they provide good services, but they are not going to solve our problems in healthcare. So we need to redefine the healthcare system in terms of a primary care team. We need to think creatively about members of that team. We need to pay differently for that and the other services that are currently being paid for. And we very much need to engage all of us, people. We need to be aware of how we coordinate our care, be aware of our own healthcare issues, right? What are our numbers? If we have diabetes, hypertension, we need to be able to engage more effectively with our providers. We're lucky in Maine to be part of an initiative called Choosing Wisely, which starts with 5 questions when you're seeing your provider. Do I need that test or procedure? What are the risks of it and the downsides? What happens if I do nothing? Are there less costly alternatives? What is the cost of the procedure I'm getting? When's the last time that conversation happened in a doctor's office, right? So we need to be able to have those conversations. We as providers need to be willing to receive those conversations and those questions without the look, right, or the put down or the put off. So we need to change both sides of the equation, and importantly, we need to connect with community resources and support them, which comes back to paying differently. If all we pay for is hospitalizations and CAT scans and MRIs, that's what we will get. We are vastly underfunding our community-based resources. We don't pay for many of the care coordination, the Meals on Wheels. You all know this. So we have got to get our policymakers hearing that. We have got to change the way we allocate resources in order to support that community-based approach. So with that, I'm not sure I totally answered your question, but
I think you did or started to, and I think healthcare is another good example of one of those areas where we can all be paralyzed by it and the enormity of it, but I'm glad that you mentioned some of the innovative things that are happening in Maine, because we can be proud of some initiatives that have started. We need to do much more, but Maine is looked to as a model for many of these healthcare initiatives. So thank you for that summary and synopsis, and we're going to move now to Evan Richert, and really quickly, we just heard from Charlie Colgan say two of our priorities have to be getting young people to move to Maine and changing the housing market. So we routinely hear stories that older people who want to stay in their communities can't for a variety of reasons. We also hear stories of young families, as Charlie had mentioned, having difficulty finding appropriate housing as well. So what's the solution from a planning perspective? Is there anything communities can immediately do to help older people stay in their homes?
Well, we have the solution. Thank you, Mr. Speaker, and thank you for having me. Evan Carroll's resume looked fantastic, and I wish I were he. The solutions are pretty much in front of us. They are not mysteries. We've just had kind of a collective amnesia about the solution in terms of community forum. Can't hear? Closer. So I think all of you probably can envision this yourselves. But just in case, if you promise not to go to sleep, close your eyes for just a moment. And imagine a New England village. Could be Cornish or Rockland or Booth Bay Harbor or Damariscotta or Norway or Fort Kent. It might be a old trolley suburb like Meeting House Hill in South Portland or Little City in Bangor. It might be a hamlet like West Kennebunk or Springvale or Steep Falls and Standish. Now, put yourself in an advantageous position in that place. Nice spring, warm day, and turn slowly and take in everything that you see. Probably you see people. You also see cars because main streets and highways go through many villages, but you'll see people undoubtedly, probably people walking. You'll see buildings. You'll see lots of buildings. And many of these will be homes, especially on the side streets and in the back streets and in the little street network, but you also see some businesses and some stores that sell some necessities, maybe a convenience store with some gas pumps, probably some sort of public building, a firehouse or a community building or a town hall or a post office. And look around a little bit more and you'll probably see a green or a park at the middle, somewhere near the center. And if you look over the roof lines for just a minute, you will see canopies of trees in the yards, growing out of the yards and the open spaces in the surroundings. And you'll see all of this really within quite a small area. You'll see all of this activity probably within an area that is no more than 30 or 40 acres in total, certainly no more than 1,500 to 2,000 feet from the center from where you're standing out in each direction. So now you've got the answer. You've got the prototype. That prototype is all around us, and it is the prototype of a form that is so flexible, so functional, that I think, and I know that we talk in terms of aging-friendly communities. I hadn't really heard that term so much, but I'm hearing it more and more, and I understand what it is. But the important thing here is that if we can achieve the aging-friendly community, what we have really achieved is the ageless community. And that's what we should be after. The place that is so flexible and functional that it can serve people who are young and keeping hours that you and I don't any longer keep, to the parents that the speaker referred to pushing the stroller, to the empty nester, to the person who may have some disabilities and difficulty walking around. You can simply age there through all those life stages and be quite comfortable and be able to meet all of your needs. Now, the interesting thing about this is that Charlie indicated from the early 50s and especially the 1970s until really the last decade and still quite persistent, we both revered and outlawed these places. We revered them in our postcards and we outlawed them in our zoning. You couldn't build new ones. We tolerated them, we grandfathered them, which is an appropriate term, I guess, for this conference. We grandfathered them and allowed them to exist as long as they didn't expand or couldn't build new ones, couldn't add to them very much. And yet, they are coming back in style, as some of the census numbers indicate. They are coming back in style because they are in demand, as it turns out, by two big generations. The so-called Gen Y, which is the group born in the early 80s until about 2000, 2001. The oldest, the leading edge, is about 30 years old. The trailing edge has not yet reached adulthood. That's actually a big generation of people. It's the second biggest generation now in the United States. And they are very mobile. In adulthood, about 1 in 5 of them will be looking for a new place to live, and they're looking increasingly to in-town neighborhoods, small village environments, urbanized portions of suburban communities, and so forth. They're looking for places that are alive, that are accessible, and that are affordable. You ask somebody in that group, quite different than if I asked you, which would you prefer? You can only do one. You can only have one of these two things. You can have a car or you can have a smartphone. They will have a difficult time making that choice. At the same time, you've got the baby boom retiring. And what we have here is a tremendous opportunity for an alliance, a coalition of generations, an intergenerational coalition that can actually make villages and in-town neighborhoods and downtown adjacent neighborhoods and downtowns and so forth work, and to build them again and to make them legal and to allow us to build these great, very flexible, very resilient places that can serve people as they age through the years and have changing needs. Now, as to the breadth of the task that might be before you, wherever you live, you can do your own self-assessments as to how well the place you live or live around meets these needs. Because, as I say, the Gen Y is on the move. The senior population will not want to move very much. They very much want to stay right where they raise families and are familiar, and all of us are pretty secure there. But even then, 1 in 20 of the baby boomers, as they reach into the 65 to 75, 80-year-old, will move each year, about 1 in 20. And many of them are looking for places where they can get the services and meet friends and walk to get a cup of coffee and all of that stuff, and get a bus when they need it, when they can't drive any longer. So that self-assessment, you might ask a few things. Can somebody who is senior and aging, can they get, let's say, 3 to 5 things that they need on a daily or weekly basis by at least 2 modes of transportation? Can they choose between this kind of transportation or this kind of transportation just as easily, just as readily, and equally well get to 3 to 5 things that they need to do? Food, doctor, entertainment, recreation, friends, socializing. If you can't do that by at least 2 modes of transportation, then there will have to be some serious retrofit as time goes on. Can you go outside your door and walk from your house to a variety of things in places that are on facilities and sidewalks that are safe, that are designed to move you from here to there? If the answer is yes, you're in good shape. If not, you're going to have to do some serious retrofitting. So the answer's before us, I think, Mr. Speaker. It's in the villages, the trolley suburbs, the places that were built. And I will tell you, the good news is that there is a growing core of developers who want to build only this. And we're seeing good examples now in Scarborough and Portland, and I like to think we're doing it in Orono, in Saco, as the mill redevelopments and so forth. There are developers who want to do only this. And so I think we are primed to build the ageless community.
Great. Well, that is good news. And as we move to Peter, the final panelist, I wanted to let folks know that there are a couple microphones, and we would really appreciate Q&A from folks. And we have a strict timekeeper, I've been told, so I don't know how many questions can be asked, but be thinking about some questions that you might have as Mr. Vigue gives his remarks. So I've heard you talk passionately about the workers at Cianbro and how Cianbro as a company values their experience, and how you have been really focused on working on bringing in the new generation and continuing the culture that you've established there. So with that in mind, if you could share a little bit about what Cianbro has been doing to accommodate and adjust to the aging workforce.
Thank you very much, Mr. Speaker. And also, Jess, thank you, both of you, for your leadership here this morning. And I'm humbled by the opportunity to be here before all of you this morning. And let me say before I begin that we view as an organization every problem as an opportunity. If it's as simple as making a mistake and correcting it, you benefit and you improve and you share that knowledge and information going forward. And that's made us a better company because we've made more than our share of mistakes over the years. It's important maybe this morning to note that years ago we unsuccessfully attempted to develop a policy to define how we might deal with our senior team members. We were unsuccessful and unable to define that solution, and actually gave up in our attempt to really understand how to go forward. And the reason for that is we determined that everybody was different. They had different needs. And we recognized that one shoe doesn't fit everybody. And the speaker made reference to that earlier this morning. We understood that when people approached retirement, that they're going through a huge transition after working most of their lives. Some people want to work full-time, 6 months a year. Some people want to work part-time, 12 months a year. Some people want flex time, and the list goes on and on and on, and it's very difficult to identify the availability of the needs of people because of the responsibilities that they might have or things that they want to do with their personal lives. We understood that the relationships that our team members developed during their employment was meaningful and difficult to walk away from for a lot of those folks. In essence, in some cases, they considered their partners at work part of their family. And we've come to understand that senior people have different needs, from benefits to a need of human interaction. And that for some, a retirement transition is almost impossible to cope with in the initial stages of that transition. And some might think that a retirement transition is the individual's problem. And we believe that it's an opportunity for our company, and it's also a responsibility that we have to the people that helped our company grow and be successful over a period of time. We also began to understand that our people retire and they take with them a tremendous amount of knowledge and skills. And so we focused on asking ourselves a question: how do we transfer that knowledge and skill to the next generation? And I can attest to the fact that no one does it any better than our long-term team members. No one from the outside, and we've learned that we can't delegate that responsibility to anybody but ourselves. So the influence of older workers on the next generation, in our opinion, is invaluable. We learned that our younger team members have tremendous respect for our older team members and people that are seasoned, they're experienced, and particularly those who are willing to share their knowledge and their skill. And so when you come out and you try to measure the impacts of that influence, it's almost impossible, but it's very valuable, and we've learned that. We've all heard about how difficult it is to take the next generation of young people as it relates to math and science. And in particular math, where you ask a young person in high school why they don't like geometry. And in many cases, they don't understand or see the application and how important that is in their work life. So in asking ourselves, how do we deal with that? And how do we address the concerns of the young people coming into our company? Simply is to teach them how to apply it. And there's no one better than a millwright or a carpenter or a pipe fitter to teach young people and get them to understand the value of geometry as an example. Measuring the impacts of that influence is, again, very, very difficult. Our experience, though, with people has taught us that the best educators, the best role models for the next generation are our senior team members at every level of the organization. That includes our craftspeople, our supervisors, engineers, estimators, mechanics, operators, and beyond. We provided formal education for a number of our senior team members who essentially were professionals in their own area of responsibility. We provided that formal education to allow them to become certified trainers, master trainers, and mentors. And our philosophy is very simple. We must take care of our people. And that means that we need to lead with a caring heart. Regardless of their age, gender, religion, or nationality, in our eyes, our team members are all the same. And not one of us is perfect, and we're all human. So we recognize that throughout our careers and lives, that we need different levels of support at every stage of our life. And we cannot define that by a policy. And so it takes some judgment and creativity and innovation and a clear understanding of the needs of the people that's brought to us by simple communication. Our approach and our advice is to treat people like you want to be treated. Be nimble and flexible. Recognize that there's no magic pill. And again, recognize that everybody is different and they have different needs. So today we utilize many of our senior team members in multiple capacities, even though in some areas their physical capabilities are not what they might have been when they were younger. But despite those challenges, these people make great teachers and trainers and mentors and coaches for individuals and groups within our organization. And I might add that we share it with other people, both inside and outside of our industry. We believe that that's a responsibility we have. Our older team members lead orientations for new team members. They lead boot camps for potential team members from technical high schools. They go into the educational system and they participate and coach people that are in the educational process. These people lead our summer intern programs for college students. And so we encourage these folks to openly share their experiences, their mistakes, even their war stories, to educate and prepare the next generation for a career with our company. The success of our company is very, very simple to define. It's all about people. At every level, regardless of their age, everybody adds value. So I'm going to ask you to think about it. Our approach to dealing with the aging process and our senior team members is nothing more than a succession plan for our company. Keep it simple. Don't try to write around it. You'll spend more time doing that than you will executing. And we recommend that companies invest and reinvest in their people and create an environment of caring, sharing, and even though it sounds corny, love. Thank you very much.
Well, thank you, Peter. And I think that the attitude that you have about your team members is the same attitude that we need to have about approaching this challenge that we have. And I especially appreciate you noting that the difficult time that you guys had developing a policy, and that really there's one that's not needed. And one question that I've gotten from a variety of different folks is, don't over mandate, legislate, or do things that are going to get in our way. And we have certainly heard that, taken it in, and it goes in the theme of there's no silver bullet, there's no one size fits all. So while there might be some legislative things that we can do, and I think there will be, we need to be in close collaboration with one another, whether it's healthcare, workforce, or municipal planning. We need to make sure that we're all talking to one another throughout this entire process. So I see one person standing there with a question, I believe. Go ahead.
Thank you, Speaker. I wanted to first off thank Dr. Len Kay with the Center of Aging, John Nail, Chair with the Association Area Agencies on Aging, the folks from AARP and others that helped support in your legislature, Speaker, the Maine Seniors Day, which was passed last year. Now the second Saturday of every September is Maine Seniors Day in Maine. I believe we're the only state that does have a Seniors Day. Now I bring this up because I just heard, and I agree, that we have to be careful with what policy we try to move forward, and that it will be tough to carve public policy around issues of keeping seniors in the workforce, keeping seniors issues first and foremost in front of our legislator, because it's such an inordinate part of our population. However, I would like to see that through this meeting and with the people in this room, in the panel, that some public policy can be crafted that makes Maine unique, that would attract more seniors to come to retire, because the reality is that seniors that choose Maine tend to come here with significant assets. They adopt our communities. They're the philanthropists that help all the nonprofits, in other words, seniors helping seniors to some extent. As well, they've been responsible for volunteering in communities, hospitals, and education, etc., getting to the point of mentorship. I happen to know with Cianbro and with Peter Vigue that indeed some of the seniors that they have at Cianbro that have been mentors to other workers are folks that have worked in different parts of the country but have chosen to come back to Maine to retire or semi-retire. In fact, one in particular was used in the Cross Center build out up in Bangor for the new Civic Center up there. So I'd like to see that some kind of public policy or some things that we do show up on the radar screen nationally, particularly up and down the East Coast, where folks look to places like Maine, New Hampshire, and Vermont to retire. Thank you.
I think that's great feedback, and I think that making Maine a unique place to to be. I think that the asset is in that. I mean, it is an extremely unique place to live, and with all the folks that visit our state, I think a program that visiting to retiring, making that transition and making it an attractive place for people to come and spend their senior years. So thanks for that feedback, and certainly we can incorporate that into, I don't know if anybody wanted to respond to that at all or not. I see Senator Haskell's ready for the next question if not. Okay, Senator Haskell.
Thank you very much, Mr. Speaker, and ladies and gentlemen. I have a question for Dr. Letourneau, and it has to do with, the question for Dr. Letourneau has to do with this concept of integrated health care. We hear all the time about health care needs to be more inclusive, and yet one of the areas that is consistently on a separate track is dental care. Its insurance is separate, its locations are separate, its referrals are separate. It doesn't seem to be a truly integrated, and I think it's a very important for our population in general, but for our population who's aging. Are there any efforts in place, and how can we get that barrier broken so that does become an integrated part of our healthcare system?
It's a great question. As we like to say, the head really is still connected to the body, right? And we've done a phenomenal job of trying to separate them off between mental health, behavioral health, and oral health, as you point out. So I completely agree. I think we have seen some great progress in terms of the integration of mental health and physical health, behavioral health and physical health over the past 5 to 10 years. Great leadership in this state through organizations like the Maine Health Access Foundation and through our provider community. So that gives me hope. I would completely agree that we are 5 to 10 steps behind in oral health, but if we think of the kinds of things that have led the integration of physical and behavioral health, I think there's some lessons there from statewide leadership on it, really making it a priority in terms of funding, improvement initiatives, education. I think educating our consumers who have that expectation is huge. Pushing for training that integrates, and then certainly payment policy is an important factor. I think there are some very good examples of that. We have federally qualified health centers around the state that have high degrees of integration with oral health. Penobscot Community Health Care up in Bangor has a dental health residency where they have, I think, something like 25 or 30 operatories, dental operatories in the primary care setting. We have great programs like From the First Tooth that Maine Health is supporting that teaches primary care providers to do fluoride varnishes. So I think we need to build on those examples and again really learn from the successes of other integration initiatives, and we've got a long way to go. You're right.
Thank you. Another question.
Thank you. This is a question for Mr. Richert or maybe Dr. Colgan. I certainly appreciate your vision of and presentation of the benefits of bringing people closer to population centers. Certainly would make it easier to deliver home care, as we've experienced in Maine over the last 30 years. But my question is, living with the legacy of the 2-acre minimum lot size, financially, how do people make that move when your home is likely your major asset, even if you want to leave? If the market is moving people towards population centers, how do they get the value out of that home that allows them to make that move?
Well, we've kind of painted ourselves into a corner, haven't we?
To a suburb,
It's
at least.
not as if people weren't warned. But no, it is a serious issue, and I do think that the decentralization of services is something that is entirely possible. People generally want to love where they live, want to stay where they live. Many, homes on 2-acre lots are some very beautiful homes with very beautiful neighborhoods in that setting, and people want to stay there and will stay there for as long as they possibly can. Meanwhile, there's have to be a decentralization of services, and that includes technology. It includes very high-speed, fiber optics. I think that's something that we've got to give much more serious attention to. Delivery of medical care and education and entertainment and so forth digitally will be a part of it. There are innovative transportation solutions. Kathy Freund down in Portland with her ITS network of volunteers and staffed transportation services. There's also simply the possibility of beginning to slowly change some of the land use regimens, and these places it's not as if they're stuck in cement. A 2-acre subdivision can become a 1-acre subdivision. There can be added lots. There can be things built around them. We just finished a project down in southern Maine through a project called Sustain Southern Maine, where we took 9 pilots from hamlets as small as Steep Falls and West Kennebunk to urban, to downtown adjacent neighborhoods as large as India Street in Portland. And every kind of setting in between. And we demonstrated how you can retrofit each of these to accommodate this kind of mixed use, walkable, very comfortable and appealing growth in each of those kinds of settings. So actually it's not at all, it's daunting, but things are entirely possible.
Thank you, Ken.
Hi, Ken Capron from MemoryWorks. The question is for Evan, whichever Evan wants to answer. Actually a comment and then a question. The comment is that we have a lot of those villages you described, like West Kennebunk, except we've done something horrible to them, and we've put a main thoroughfare right down Main Street. And so in my community, which is Riverton in Portland, we've got 302 right down the middle, and most of the day you wouldn't let your kids out into the neighborhood if they're going to cross the street. So, you know, in thinking ahead, maybe we should find a way to move that thoroughfare, the throughway, outside the main village, because that destroyed a lot of village thinking. My question for you is, has anyone ever considered doing a Columbia, Maryland type thing, of a built from the ground up village just for seniors, or just for a specific population that is designed to work in that elder-friendly community?
Well, I see Charlie shaking, but you know, two comments. First of all, the Columbia-style new town development is hard to do in Maine simply because the absorption rates are too slow. The upfront investments are too great, and the absorption rates are too slow, and so it's just such high risk to be able to do that for any demographic group. Now, you take the Highlands in Topsom, or Huntington Commons in Kennebunk, or a place like that, or Darrigal Pines in Orono, and you get smaller scale versions of that. But importantly, they can be integrated into something bigger. And I think the most efficient, effective way of doing this is think big picture, but start implementing incrementally. Whether it's building by building or lot by lot, allow infill, allow small expansions, allow incremental expansions of the sewer system, you know, and just make sure that you're following certain universal principles of community design and community form that are well understood. They're well resisted, because the first time you do that, at the end of somebody's dead-end street, and oh boy, you've got a law case. But attitudes are changing, and there's a lot in it for everybody, even the people at the end of the dead-end street. So I don't know of a elder-specific, large-scale Columbia new town for elder. I'm not even sure I would support that. I think the isolation of demographic groups is, in the end, it's not resilient enough. You know, demands change, demography changes, and it's not going to be resilient enough to withstand that change. We have forms that are.
Before we have time for one more question, but I do want to acknowledge people's time. And I think that, Peter, I'm not sure if you need to step out or not, but before you did, I wanted to acknowledge and thank you for participating here prior to going to our last question and moving on for the rest of the day. So thank you for being here today.
Also, I think it's important to acknowledge Dr. Steve Pound, who is Director of Education in our company, and also Mike Bennett, our Vice President of human resources in a company. They'll be here today, and they'll be able to answer any questions you might have.
That's great. Thank you. Our final question.
I really have more of a comment. I wanted to return to the issue of the decentralization of healthcare and the use of technology. My name is Margaret Grady. I'm from the Northeast Telehealth Resource Center. We are a federally funded resource center. We serve the 7 states of New York and New England, and our mission is to improve access to healthcare in rural and medically underserved populations. And certainly healthcare is becoming much more personalized, much more mobile, much more decentralized. And so that issue of connectivity from the home to the healthcare provider through technology is becoming much, much more important. One, I think that we need to, it's an infrastructure issue that we need to address here in Maine. And I just wanted to let people know that we are available. We are a free service available to anyone who wants to call us. You can find us on the internet at netrc.org. And we are, actually our home is here in Augusta at MCD Public Health in Maine, although we do serve the 7 states. And if I could just say one more thing about oral health, another resource that's available to you is the Maine Oral Health Coalition that recently refocused. It used to be the Maine Dental Access Coalition. We recently reformed ourselves as the Maine Oral Health Coalition with a focus on integrating oral health into the rest of oral health. And so we want to have a presence at every table that's talking about health so that we can reach that goal of integration. And if you're looking for resources, the Maine Oral Health Coalition is another place where you can go. Thanks.
Great. Thank you for those comments and that feedback and those resources. I think that technology you touched on, and that was one thing that we haven't really touched on in a big way, but it is a big thing and it will be part of the big solution. So it's going to be one of those things to watch, and with the innovative models of what the university is doing, it is part of the key to our answer. So we I'm getting the signal to move on, but before we do, I did want to thank Charlie, Lisa, and Evan for being here today and participating with us and helping it be a rich conversation. Thank you.